You're watching EAC News. Thanks for joining us. The highly infectious Omicron coronavirus variant causes less severe disease than the Delta strain, but it remains a dangerous virus, particularly for those who are unvaccinated, the head of the World Health Organization (WHO) has announced on Wednesday.
The World Health Organization Director General Tedros Adhanom Ghebreyesus has said more than 90 countries were yet to meet the target of vaccinating 40% of their population, and more than 85% of people in Africa were yet to receive a single dose.
Let's be clear. While Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. Almost 50,000 deaths a week is 50,000 deaths too many. Learning to live with this virus does not mean we can or should accept this number of deaths. We must not allow this virus a free ride or wave the white flag, especially when so many people around the world remain unvaccinated. Some of the supply constraints we faced last year are now starting to ease, but we still have a long way to go to reach our target of vaccinating 70% of the population of every country by the middle of this year. 90 countries have still not reached the 40% target, and 36 of those countries have vaccinated less than 10% of their populations. WHO and our partners are actively supporting these countries to overcome the bottlenecks they face in leadership and coordination, lack of supply visibility, short shelf life of donated vaccines, limited cold chain capacity, vaccine confidence, health worker shortages, and competing priorities. WHO hosted a global webinar attended by clinicians from around the world on the clinical management of COVID-19 during pregnancy, childbirth, and the early postnatal period. Pregnant women are not at higher risk of contracting COVID-19, but if they're infected, they're at higher risk for severe disease. That's why it's vital that pregnant women in all countries have access to vaccines to protect their own lives and those of their babies. We also call for pregnant women to be included in clinical trials for new treatments and vaccines. Fortunately, mother-to-baby transmission in utero or during birth is very rare, and no active virus has been identified in breast milk.
He has also said the majority of people hospitalized around the world with COVID-19 were unvaccinated, and that if transmissions were not curtailed, there was greater risk of another variant emerging that could be even more transmittable and deadlier than Omicron. In its weekly epidemiological report on Tuesday, the WHO reported that cases have increased by 55% or 15 million in the weeks of January 9, compared to a week earlier, with it by far the most numbers of cases reported in a single week.